So I still feel like I'm a nurse and still taking care of patients, just in a totally different perspective. It's more like the big picture from the high level point of view. I'm impacting thousands of people versus just my population at the hospital.
Welcome to Nursing Beyond the Bedside. I'm Audrey, your host, and a nurse who pivoted my path several years ago. After 8 years as a critical care nurse, I was ready for change. I craved higher pay and more flexibility, but was struggling to find a clear path forward. Fast forward through positions in recruiting, customer success, and marketing, and many lessons learned along the way. Today, I run Pivot Path, a company dedicated to empowering nurses to redefine their careers. This podcast is designed to help you navigate the journey from clinical bedside nursing to a fulfilling career that aligns with your passions and goals. Here, you'll discover inspiring stories from nurses who've gone beyond the bedside, successfully transitioning to non-clinical roles, or redefining their nursing career. Join us as we hear their stories and share actionable strategies to help you make your own leap. Whether you're a new listener curious about what lies beyond the bedside, or a returning audience member in need of some fresh motivation, this podcast is your go-to resource for exploring new opportunities that can transform your career. Let's get started. Today, I'm thrilled to welcome Sasha Lopez, who has over 15 years of nursing experience and has transitioned from bedside nursing to healthcare technology. Sasha is a clinical success consultant at Rapid AI, where she leverages her clinical expertise and firsthand knowledge of stroke systems to help hospitals across the country improve patient care. After starting as a nurse at a young age, Sasha's career has evolved from long-term care to critical care to health tech. In this episode, we'll discuss Sasha's journey from bedside to AI-powered tools in healthcare, the role of nurses in non-clinical jobs, and how technology is reshaping the future of care delivery. Sasha, welcome to the show.
Thank you for having me.
Absolutely. Well, I always like to start the show by getting a little bit of background so that the audience understands the perspective that you bring to your current role and kind of like where you are in your career today. So I'll let you jump in and kind of give us the groundwork for your nursing career.
Yes. So as you mentioned, I started off my career a little early. I actually went to licensed practical nursing school first. So I graduated at 19 years old, started my nursing career right out of high school, went through a very accelerated program, jumped right in, then got my ADN, and of course climbed the ladder all the way up to my master's. So I have a master's now with informatics as an emphasis. And I started in long-term care, of course, where the LPNs were accepted. Now you'll probably see them more and more into the hospital. But at the time, it was just in long-term care. So now we are here in Rapid AI with tech. I actually, as you mentioned, was a customer of Rapid AI. I am a critical care nurse in the hospital acute setting, and I went down the path of installing and implementing technology to better serve our patients, expedite treatment care, and help with treatment of acute stroke patients. I know it's a mouthful.
Yeah. And after you were in long-term care, you did have experience working with like neuro patients while you were bedside. Is that right?
Yes. I was a critical care ICU nurse in the neuro unit.
And so between that experience on a neuro unit and your degree in informatics, I feel like that must have set you up really well to then, eventually make a pivot into the health tech world. Can you share a little bit about how you feel like those experiences in particular gave you the skills and knowledge that you needed to take that next step?
Yeah. So like most of us, I didn't know what I wanted to be when I grew up. I still don't. I'll probably say that till I'm 80. That was something my grandfather always said. So you never know what you want to be when you grow up. So always continue to look at those opportunities and those doors that can open at any time. I knew when I was in critical care that I was going to leave the bedside. It's exhausting to have patients struggle, and sometimes they don't make it. And that can be mentally and emotionally exhausting over time. And of course, this was before COVID. I can only imagine how current nurses feel today in the critical care world. But I had an opportunity to interview someone during my master's program. And that was kind of my door. That was when my door opened, where I was able to interview an advanced practice nurse for my master's program, specifically on data analytics. And I didn't expect it, but they were looking for someone to come over into the analytic world. So that was my first step away from the bedside, because I left critical care ICU to go into a data analytics role, which is really not informatics either. But I do have a love for numbers, and I do love patient outcomes and being in the quality world. So that was my first door that opened into outside of the bedside.
Yeah, I love that you mention, just keeping your eyes open for opportunity. There are so many nurses I have on the show that their first door to open came from an opportunity that they weren't expecting, and often from a connection that they just made along the way. So I do think that, networking and keeping your mind open to those opportunities is really important. Just because I feel like the quality in like data world can be a little bit foreign to bedside nurses. What were your like roles and responsibilities? Like how would you describe what you were doing in that data role?
Yeah. So in this role, it was called the Quality Outcomes Data Analyst. It had a very, very long title, but essentially I worked at a system level over a large communities. It was a community-based center at the time. And then I moved into a management role at another institution over in academic centers. So I would manage the data that is abstracted and a team of us to submit the data to our accreditation bodies. So you're looking at patient outcomes, you're looking at chart reviews, but how quickly you need to chart review, provide feedback to the physicians and the care teams to let them know, hey, this isn't best practice. You're able to provide workflow changes or best practice changes within your organization. I really felt like a change management person. Even though I was delivering bad news, oftentimes, because I'm chart reviewing, I have to review what's real and what's really documented. You would find lots of opportunity for improvement within the quality world. So that was a very interesting role.
Yeah, definitely. I feel like quality roles are great for nurses who are always asking why and, want to go to that next layer as to like what the root cause is and how things can improve. So it's cool that that was kind of your first transition. And then so after that role, is that how you found your way to Rapid AI?
Interesting enough, as a customer of Rapid, so I used it in my world. We had Rapid at all of these institutions that I worked at, helped implement them and get them going because it does streamline patient care, improves inefficiencies and communication barriers. It popped up as a LinkedIn profile. To be completely honest, I went through a project with Rapid with one of my colleagues now, and then it popped up as a LinkedIn recommendation, and I honestly went out on a whim. I applied for the job, not thinking I was going to get a call back. I went on vacation. I got a call from my current boss now and had an offer within a week. And so I was not expecting it. And my husband, who is not clinical whatsoever, he said, you're going to apply at that place where you have notifications go off when people have strokes. And I was like, yeah, the app. Yes. I'll never forget him saying that. He was like, you're going to go work for that company? And I was like, yeah.
That's awesome. Okay. So tell us, just like at a high level, tell us what Rapid AI is and what they do. And then I want to get further into like what your position is and how you, use the skills and experience that you had as a nurse to excel in that role.
Sure. So Rapid is an AI, an artificial intelligence software that is installed on the CT scanners or MRI scanners to provide artificial intelligence interpretation back to the stroke teams, care teams. We offer it not only for stroke, but for pulmonary embolism and aneurysm, but primarily our flagship product started with stroke. So we're streamlining the care for all of the care teams to communicate and have the information at their fingertips. So for instance, patient comes in, they have a code stroke called overhead, they go straight to the CT scanner. When the patient is scanned, That image then is pushed automatically to PACS and also to the Rapid Mobile app. So the care team has that information no matter where they are. If they're in the bathroom, if they're down the street at a party, that physician or team knows exactly what's going on about their patients and when they need to respond to an acute code stroke. Same thing for pulmonary embolism, but it started with stroke.
Cool. And so your role with them, what is your title and how would you describe your day-to-day?
Yeah. My current title is Clinical Success Consultant. When we were first hired on, it was more of a consulting role where I am Lean Six Sigma background. We do lots of process improvement, but it is kind of morphed into more of a customer success role in conjunction with that clinical consultant piece. So with my project management background, we're providing expertise as the subject matter experts to these executive teams and stroke teams across the country, helping them improve patient outcomes. So I'm not sales. Even though I partner with sales and I'm part of a commercial org, it is really is a clinical role because we want to show the clinical team how this product's going to impact their current workflow. How is it going to help them take better care of their patients? And usually everybody's like, oh my gosh, this is so cool. But it's just a help. So I still feel like I'm a nurse, still taking care of patients, just in a totally different perspective. It's more like the big picture from the high level point of view. I'm impacting thousands of people versus just my population at the hospital.
Yeah, absolutely. And you mentioned Lean Six Sigma. That is going to be a foreign term to a lot of the nurses listening. So tell us a little bit about what that is and why it's important.
Yes, I am process improvement, specifically Lean Six Sigma Black Belt. I took a certification to help improve processes. It actually was taught to me by a bunch of amazing engineers. So it started in the Toyota world. If anybody wants to look up the history of Lean Six Sigma, it started in the manufacturing world with Toyota. And then, of course, was adopted by all the different manufacturing plants. But having the same outcome and creating a process with no variability. And that's what it's kind of centered around. And it's taken into the healthcare world now, where we apply the same principles as manufacturing to patient care, which is kind of funny because patient care is not one all be all. And you have to think about like all of the nuances and the special cause variants that can impact a patient during their stay and throughput through a facility.
Yeah. Did you get that certification in your quality role?
I did. It actually wasn't required, but I lived inside of the quality department working with all these amazing engineers. And I wanted to feel like I made a difference because at that time, I'll be honest with you, I was bored and I was behind a computer going, okay, I have this master's degree of informatics and I'm just sitting here plugging away with data all day long. Granted, it was easy, but that I didn't feel like I was making a difference. So I went and sought out another certification to try to make a difference, grow myself internally, because I still didn't know what I wanted to be when I grew up. And it's proven to serve me well, even into this role.
Yeah, it's great. You've had like building blocks starting with like just nursing in general, and then, the neurocritical care, and then the quality management to what you do now. Like it seems like each role has played an important part in the next.
You got to have a good leader. You got to have somebody that will support you and grow you and coach you. That is like the biggest thing. And I'm sorry, I'm going to sidebar for just a second.
Do it. Yeah.
If you don't take anything from this podcast, when you are looking at roles and jobs and looking to change jobs, you better have a mentor. Your coach, your boss plays a bigger impact on your mental health than your doctor does. And you have to look at that. Sometimes you need to be rich with happiness rather than money. Money is not everything. That's my sidebar in my soapbox. And I preach that all the time. I'm like, if you don't love your boss, there's no point. If you can't talk to your boss, there's no point.
I agree. That makes such a huge difference in just like your everyday happiness, fulfillment, like, and it will make you if you have a good leader, you as an employee and a team member will be much more motivated and driven if like you feel like you're working in a supportive environment. So I couldn't agree with you more on that. So thanks for calling that out. I think that's a good one. So how do you think that your nursing background specifically, and whether it's like neuro or just like nursing in general and the skills and experience that you had as a nurse, how do you think that that plays into your clinical success role, or even more generally, like a nurse pivoting into a customer success role?
Mm-hmm. Absolutely. I can speak to my own experiences. So whenever I am talking to my customers, sometimes they don't know what to ask. They look at me and they're like, I don't know. I've never implemented this. I have no idea what questions I'm going to have for you. Come back to me in 3 months. So having that nursing background, I will say that my boss is brilliant and she hired all nurses on our team and we're all stroke coordinators by background. So
Smart.
we can all relate to that person on the other side of the screen. My role is primarily remote unless I'm traveling. And having my stories to be able to tell them, hey, this is going to help with throughput. So that way at 3:00, when your ER is busting at the seams and your ICU needs to downgrade a patient, this product's going to help you because you're going to be able to get the patient out of the ER faster, into the ICU. If I wouldn't have had any of those stories, they wouldn't have trust in me. And in all honesty, they wouldn't. They would look at me and go, how are you going to tell me how to fix this?
Yeah, exactly. And the healthcare environment is just so unique and comes with its own unique set of challenges and workflows. And unless you've actually like worked within that setting, I really don't know how you could know. Like, of course, like at a high level, you can understand that like moving patients is important and getting them the right care quickly is important. Like, yes, that all makes sense at a high level, but like, unless you worked within that environment, to your point, like you don't really know the specifics of where that flow gets bottlenecked and like what the reasons are for that. So I think that it's really cool that you're able to bring that perspective to those conversations and like actively like problem solve with them in those moments.
Thank you. It's fun. That's when I have the most fun, is when I actually feel like I'm helping them.
Yeah, for sure. I think that, clinical success, customer success in like a healthcare adjacent company, I think is such a great place for nurses because it's important that you're able to like build and maintain like relationships and like communicate well. And you're a creative problem solver and resourceful. So I think that nurses, because of what we're doing at the bedside every day, stepping into a role like that is, I won't say it feels totally natural because it's obviously very different, but it is a natural use of the soft skills that we've developed through our bedside experience.
Yeah, it was very, it was challenging initially going over into the industry world. So like leaving the bedside was one world, and then leaving hospital was a whole other world, jumping over here into the industry or corporate world. You have to change the way you communicate. I'll give you a kind of a funny story. So
Yeah.
in my prior role, I dealt with a lot of, no disrespect to physicians or headstrong neurosurgeons, but they can be very unique to talk to. Sometimes you need to be very, very direct. Coming over from that world where I am the center of the conversation and directing traffic all the time, and then coming over here into the industry world where you all play well together and you need to pass the ball to one another, where you bring this type of skill set and your colleague brings another one and you can't have all the answers. So the industry was totally different, and it took me a little bit to adjust, but don't get me wrong, I still love it.
Yeah, absolutely. It's funny that you mentioned communication and just like the way that nurses have to communicate, especially like in a critical care setting. I was a trauma nurse. So like when I'm used to like very like direct, like closed loop conversation, and like we're trained on that. And coming over like into, especially I would say the virtual world where like you're communicating over like a virtual, like via text over a virtual platform, that super direct, like closed loop communication sometimes comes off as like too succinct and too direct. So it's interesting that you call that out.
Yes, you need to soften it a little bit. They're no longer neurosurgeons anymore that you're dealing with. You no longer have when you're internally working, you no longer are working with a patient on the line where, like you just said, you need to intubate now. There's no time to play around, no side chatter. There's now to have side chatter. So totally different stress. I have to say that my stress levels have drastically went down. Different stress now. You still have stress.
It is a different stress. And I have found that in even talking to a lot of nurses on this podcast, it's not like the job that you move into is like completely stress-free. Right. There is stress, but you have the perspective of the stress that you dealt with as a nurse being life and death.
Yes.
And, you know, the stress and the urgency that you deal with in another job is, you know, there's a deadline and you need to get this deliverable done by a deadline. And of course, like that is important, but like no one's dying.
Right. No, you're exactly right. You're exactly right.
What else, particularly maybe like with the work from home aspect of your job, were there other things that you found difficult in your transition from really nursing and just like hospital work to like remote work?
Initially, I'll be honest, I struggled with not having physical contact and talking to people in person and having those little, you know, you go to the coffee pot, hey, how's your life? How's your weekend?
Yeah.
Having the side chatter. I missed that initially, which is why I have a dog and a cat running around in the background. Those are my coworkers, but I to love this because my commute is gone. Spending an hour in traffic to and from work is the most annoying thing to me. I actually think I work more being in a remote position because I have to remind myself when to turn off the computer versus when you're in a facility and you leave for the day and you leave the computer behind you. So I've struggled with that. I've struggled with communication with colleagues, and then I struggled with how to stop working, which I think everybody really does. And I have an unlimited PTO policy, so I can take off at any day. That's another new thing. Like, what? I don't have a date. I don't have, and it's proven, by the way, if you look this up, our VP of HR says that we want you to take off because when we give you an unlimited PTO policy, we find that people do not take off work. So I actually have to make myself, you know, hey, I probably should take off a day or two.
Yeah,
you
definitely.
Just keep going.
I know that exact experience, you know, with your computer, like right there in your home. It's like, oh, like, let me answer one more email. Let me, you know, just work on this one thing, whatever. But yeah, it is a much different world from, first of all, that commute that you're not getting paid for. You're not on the clock for that. And then you do clock in and you are, I don't know that I want to use the word captive, but like you kind of are for that like 12-hour shift, you know, like you're not running errands, you're not making other phone calls, you're not like picking kids up from school, whatever it is. But your day is very structured to where, you know, you have 12 hours, you have tasks that need to be done throughout the day at a certain time, and then you go home and you can leave it behind you. Then switching to remote, it's like work is always present. So you do have to learn to set boundaries for yourself because it is always right there. But then that work-life balance, if you can figure out how to appropriately set boundaries, the work-life balance is something that like really as a bedside nurse, I didn't understand that this even existed. Like a world where I have unlimited PTO and, you know, if I need to go to the doctor or pick up kids or like something during the workday, and of course every company has their own like policies on this, but like chances are it's fine. Like what really matters is that like you're getting your work done by the deadlines that it's required, and the rest kind of doesn't matter as much. So yeah, like having that flexibility is such a game changer and something that like seriously as a nurse, like a shift worker, I didn't even realize that like this type of flexibility and balance was like real.
Did you ever work back to back 12-hour shifts?
Oh yeah.
The third day, you're exhausted.
Yes.
And your feet hurt so bad. I remember they were like, you only work 3 days a week. And I'm like, yeah, but this fourth day, I have to take off to recover.
Right.
From
yes.
these 16-hour days that are really not 12-hour shifts. They're really 16 when you document all night long. After, you finish your shift and then you spend 3 hours documenting, you're exhausted. And I used to take it to really recuperate and rest. And I would track myself. I would go like 8 miles a day. I would walk around.
Yes.
I literally would get that many steps in because you're just constantly running.
Yeah, so it's pretty crazy. I mean, I used to insist that 3 days of work was better than 5, but I was the same way. Like I preferred to do my 3 days in a row, but by day 3, like 100%, I was dead. All I wanted was for that shift to be over and to shower and get into my bed. And that next day, I would sleep half the day. And then the second half of the day, I needed to like catch up on the things that I haven't been able to take care of for the past 3 days because I've been working such long hours. So switching to the 5 days a week when it's like, oh, like I have some flexibility within my workday, but then I also am done by like, 5 and I can spend the afternoon doing what I need to do, like cooking dinner, taking my dog for a walk, working out, whatever, the things that just got totally neglected on a 12-hour workday. Yeah, exactly.
Appointment. Yeah,
exactly. Okay, so I love that we've talked a lot, just like your transition and kind of the building blocks and how doors have opened for you, as well as some of the challenges of switching to remote life, as well as some of the benefits. So if you were to talk to a nurse who is in your shoes, let's say when you were still like neurocritical care and like they're maybe in that same mindset of, I know I can't do this forever, but I'm not exactly sure like what else. What advice would you give to them if they're interested in a path similar to yours or just kind of exploring new opportunities?
Yeah. Definitely the first thing, if I could go back and look at what I would have done differently, is always that mentor. I think as a new nurse, we're chasing money. I mean, it's just the truth. I'm just gonna be honest. We're chasing that dollar. How we're exhausted because we're physically exhausted from working so hard. We're like, okay, how can I make this money and not feel like I'm dying after 3 days, and not kill my back after 20 years and need to have surgery? That's usually, and I'll be honest, that's what I was looking at. I was looking at it back then as hey, this is great. Get away from the bedside and then have an amazing career that's still learning. I would recommend that nurse take a look at the trajectory of the path and where they see themselves, not in 5 years, where they see themselves in 10 years. Because you really need to think about that. I ended up capping out at one of those positions where I was at the highest salary, and there wasn't an opportunity for me to be a management position. So that's why I switched organizations. And looking back now, I probably would have thought a little harder on that. Because a lot of times I don't want to be the nurse that bounces from organization to organization. There are people that want to be loyal and want to stay in an organization for a long time. So think about that when you're looking.
Yeah. Absolutely. I think it can sometimes be hard for a nurse to really understand what the growth potential can be from any given position, especially because we're used to like kind of accepting a role and somewhat being locked in and having that cap. And so I think that mindset shift that like in non-clinical, like in non-bedside jobs, the growth, like the ceiling that we have on our jobs in nursing does not necessarily cross over to a lot of like non-bedside jobs. In a lot of cases, you can just continue to grow, even if it's like a slight pivot from the position that you're in at the time that you accept. So I do think that, even in that case, going back to having a mentor, like talking to people who have made moves, listening to this podcast, reaching out to people on like LinkedIn and just networking and just kind of learning what that growth trajectory can look like, I think is really important. But at a basic level, I do think that it's important for nurses to, and I did not, like, admittedly, I did not do this until like later into my own career pivot, but I think that taking the time to like kind of pause and reflect on your own values and priorities, like what's important to you in your own life, because of course money is important and we all like want to make the most money that we can doing what we're doing. But I also think that it's important to weigh that with like your work-life balance and like, are you going to miss holidays or are you going to have unlimited time off? Like what really matters to you and what is going to matter, 10 years down the road. So I think that that's great advice. And I also want to touch on a little bit, like with you working in like the health tech space, especially in a space where AI is being used, because there's a lot of chatter right now about AI and AI in healthcare and what that's going to mean. Do you have any thoughts on nurses, the role of nurses in the adoption and integration of new technologies into clinical practice?
Any advice?
Just like any thoughts on like, is there a mindset that nurses can have about technology, or is there, certain experiences and values that like nurses can bring to the tech world where technology is being built and implemented? Like, how do you kind of view the role of the nurse as we like enter this new age of tech?
Yeah, okay. So I recently read an article just this week about how it's from Becker's. It was published this week, and it was how nurses interpreted AI, which is why it caught my eye and why I read it. And the number one thing was the nurses were concerned with, based on this survey, was accuracy. And as I started going down the list of like the top 10 items that they were most concerned about, the last one was actually like helping them. The very number 10 was like the least concern of helping them. And then I took that and looked at my own role and how I work with nurses. A lot of times I walk in and they're like, no, this is going to replace my job. Or no, this isn't going to help me. This is just something else to do. This is another box to check, another application to communicate on. But if you provide the feedback as a product leader, you can actually provide advice on how to develop artificial intelligence. So we recently hired a nurse background into the product development team. So not only is she working with engineers and project managers, but her critical care and nursing background give her a completely different insight on how we should develop something. So that's like a totally different pathway than for me, where I'm over here on the customer side and helping people be successful. You actually can work in the developmental pieces for AI. You can actually help develop it. And so vendors like myself, we reach out to our customers and say, hey, how would you like this new feature? Tell me your feedback. So be open-minded. I would like to see nurses be a little more open to it, just because they help drive and they help develop the new technology in today's world.
Yes.
It's from a nurse.
Yes. And it's funny that you bring up really both of those points. I was actually just chatting with someone this morning who is responsible, like works within a healthcare system and is responsible for helping with the implementation and like rollout and education around like new technology that system has chosen to adopt. And she was saying that one of the biggest pain points is actually just getting like nurses and physicians to like buy into this like new thing. And I honestly remember being there myself as a nurse when like a new EHR is being rolled out and you're kind of like, oh, like, and I think that like part of the problem is that nurses are so busy. We're already spending that time like after shift, like you mentioned, like documenting and like doing these administrative tasks that it's like, I really don't feel like I have the extra 20 minutes in a day that it would take me to use this new tool because I'm still learning it and I'm going to be a little bit slower at first. So I think that like if we could remove some of the pressure on nurses and just like, the amount of things that they're being asked to do with their limited amount of time right now, I think that it would be easier to get their buy-in on these new products and tools, just because if they're not so pressed for time, then they've got the extra 10 to 20 minutes in a day to like get used to this new thing, But
really
the second thing that do what?
That's really good feedback. That that's what they need is more time. It's great.
Yeah, I think it's time, really. And then, there's the understanding too that, if this tool could then save them even more time and administrative burden during the day, then like even better. But I think it's like having that time allotment up front that they currently don't have to like dive into this new thing. And the second thing that you called out that I'm really, really passionate about is having nurse voices in the development of new technology. We understand healthcare and just like all of the different things, all of the different facets of healthcare and workflows and working with patients and everything, that I think that having a nurse voice in product development is so, so key when it comes to the successful implementation and that adoption of a new technology. So I actually think that we're seeing that more and more in the world today. Like there's a lot of startups and companies out there trying to build solutions within the healthcare space. And I think that, the value of that nurse experience is being recognized more. So I 100% agree that like whenever a nurse can, even if it's just, providing feedback to someone like you or something like that, like nurses should feel empowered to like use their voice and provide that feedback, because it really is important in the development of the technology that we need to fix some of the problems that we're experiencing at the bedside today.
Even if it's angry.
Yeah, even if it's angry.
Even if it's I want to hear it all. The good, the bad, the ugly is what I like to say.
Yeah, definitely. Cool. And then I know that you are passionate about leaders and mentoring and things like that. So you do some mentoring yourself at Rapid AI, I believe, right? With helping nurses transition into tech roles.
Mm-hmm. Just a little bit. Yeah. We've added a few individuals to our team and I have been mentoring them. It's been fun. I've actually enjoyed it. I used to precept nurses at the bedside. So I feel like I'm back in that role again, helping one another. So it's fun. And I see the struggles that I struggled with coming over into the industry world.
Mm-hmm. I think that having you as a mentor is very important because your experience transitioning into a role like that versus just anyone else who hasn't been a nurse or is shifting from something more similar, I think is very important because like you said, you've been there, you've done that, like you understand the like uniqueness of that type of transition. So, I think you're right. Let's keep supporting each other as nurses and just, helping each other find that next thing. To connect with Sasha after today's show, you can find her on LinkedIn. And if you're interested in learning more about Rapid AI, you can visit www.rapidai.com/about. Thanks for tuning in. Don't forget to hit subscribe to keep up with our latest episodes. And if you were inspired by today's conversation, I hope you'll share this episode with someone who'd love it just as much as you did. If you're ready to pivot your path, sign up for my free newsletter at mypivotpath.com. Get non-bedside jobs delivered to your inbox every week. And if you have questions or just want to say hi, feel free to email me at audrey@mypivotpath.com. Thanks for listening, and until next time.